Hi, everyone. Welcome to our channel. My name is Tharmila Rajasingam. I'm a real estate agent based in Toronto, and I'm a global team leader here at eXp Realty. And I have an awesome privilege to have Margo here with us. She's one of our partners, a third-party provider for our healthcare options for all of our US agents. So as you guys know, I have quite a few bit of agents that are my partners out in the US. And I really wanted to bring Margo together to share information, going to a deeper dive into all the information that you get access to when you partner with us and join eXp Realty. As you could imagine, that healthcare is one of the most important thing in our lives. And a lot of people don't even realize that brokerage could offer this, and our brokerage does. And a lot of people at our company are taking advantage, especially when they're transitioning from their work onto becoming full-time or even part-time real estate agents and wanting to have access to healthcare. So Margo, I'm going to hand it over to you. Please, if you can, introduce yourself, and if you can give us a really good presentation about all the things that they have access to when they join our company.
Absolutely. Well, it's great to be here. Thank you so much for having me. First of all, love eXp. I couldn't love it more. It is really just a lot of fun. It's very rewarding to work with a company that is this collaborative, this focused on helping agents improve their lives. And here we are able to help improve lives on the healthcare and financial standpoint. So it's a pretty big deal. You mentioned that healthcare is a big concern for people. And I have some data points I want to share with you about that. So what we know is that in the US, about a third of agents are uninsured. That's according to NAR. It's not surprising because it's so expensive and you often get very little for your money. We know that another third are on the healthcare exchange on some plan from healthcare.gov. Or the marketplace. Those are interchangeable. Those are very expensive, and maybe in 10% of the cases, they're on the right plan. Very expensive. And then thirdly, we know that the other third of agents roughly are on a plan through either their employer, and a lot of times they have a job just for benefits. This is a uniquely American, frustrating thing. And then they might be on a plan through their spouse's work. And maybe they want to bring their spouse into the business and they don't. Somebody is keeping a job just for benefits in a lot of cases. And so what we've learned is not only is this a big problem for all three of those categories of self-employed, but it's not going to change because of the way healthcare is delivered in the US through employer-sponsored groups. So by default, there's no way that 1099s can have access to those unless it's through a spouse or a job they have, until we came along and figured out some pretty creative ways to deliver high-value plans to agents. And what we've learned is, guess what? No one size fits all. Turns out we're unique. Our thumbprints say so. And so there's not a cookie cutter solution. And what we do as Clearwater Benefits is we are the partner who delivers the eXp agent healthcare to agents in the US, is that we are a licensed brokerage. So we're agnostic on which the best plan is. We want to help find the best plan at the lowest price for each of the agents we talk to. We are licensed in all 50 states. Our consultants are licensed in all 50 states. You'd think they're different countries with the difference in laws. They vary a lot. It's a pain. But that means that we need to be on top of it to be able to make good, strong recommendations. So we're experts, we're subject matter experts in US healthcare plan options for 1099s. And I usually ask when I'm presenting to teams, what word would you use to describe shopping for health insurance? And it's never once been positive, ever. It's always frustrating, confusing, nightmare, disaster, torture, it's terrible things. So we like to take that off of the plates of agents and say, just let us help you with it. We're experts in it, and we have great resources. So we have three goals that we have for when we work with eXp agents in the US. The first thing is we want to lower the monthly premium wherever possible. And that just depends on where they are, what they need, but we want to lower that wherever possible. The second thing we want to do is increase access to doctors and hospitals, because that's been shrinking while monthly prices have been going up. So we want to reverse that. That second part leads to the third part, which is we want to reduce the out-of-pocket expenses that people are at risk for having the responsibility for. So those problems, the out-of-pocket costs, almost always come from out-of-network providers. So I'll give you an illustration of what that can look like. A couple of years ago, there was a teacher here in Austin, Texas, and he happened to be a marathon runner. So he was healthy, he was lean, he was young, 45. He had good teacher insurance, and he dropped to the pavement with a heart attack. Fortunately, somebody called 911. He was unconscious. They rushed him to the hospital. His life was saved. Yay. Then he started getting bills. Boo. $105,000 in bills. Right. All because situation beyond his control. Somebody decided to go to, maybe they go to the nearest hospital, or I don't know what the decision making is for the EMS drivers, but you go where you end up going. And in this case, the local media actually shamed the insurance company to paying his bills. Most of us don't have access to that. That's out-of-pocket expense that we want to avoid. And one of the ways we do that is find a variety of plans that have more access, a broader network, more access to hospitals, doctors, and that helps reduce the likelihood that you're going to end up with those bills, right? So those are the three things we want to deliver on. And the way we do that is by having a vast array of plans. And so what that means is we've got a category of plans. I just call them the Clearwater plans. We've put a couple of different plans together, carriers together, and that gives us economies of scale by putting two different kinds of plans together. And then there are choices within that bucket of plans, that option, that category. Then we have another category that are the major medical plans like Blue Cross or Cigna, Aetna, that kind of thing. And those vary by state because each state has laws on what is and isn't allowed. And then the third category of plans, think of these as, I imagine them as literal tools on my superhero tool belt. The third category is of supplementals. So these are, think of these as a la carte. You can have all of them, none of them, some of them, whatever makes the most sense for you. So, and that would be dental, vision, critical illness, and accident policies that pay you a lump sum when one of those qualifying events happens. So those three categories of plans give us a wide variety to choose from, and we built a good reputation of helping each agent craft the right combination of plans. So we've got a lot of resources available, and that's how we deliver this service to eXp agents, is through our resources. There's a website dedicated to eXp agents in the US, and that is expagenthealthcare.com. Agents can visit expagenthealthcare.com and look at plan information. They can watch videos. They can get a quick quote. They can also book a call to talk with one of our consultants, which is actually what I recommend most people start with. But if they're not comfortable with that, they can visit the website, poke around. There's even webinars and get the information that they want. And we're here to help make the decision. Our team of consultants is very experienced. They're very empathetic. They are low pressure. In fact, we have a reputation that I'm super proud of, and that is that when we talk to agents and they're already on a plan that's really the best one, there's not anything else better for them, we will say, we recommend you stay right there. And an example of that would be any retired military who are on the TRICARE plan. Nothing beats it. Nobody can beat it. We just say, just don't move. In fact, if somebody's watching this and they're on TRICARE now, know that that is the best plan. You're good to go. Peace of mind. Move on to the next topic. Now, if you're a retired military, but you're on the VA plan, we can probably help you with that. We can probably do something a little better. But we've seen all kinds of scenarios. And one of the ways that we do something really good and different for realtors, real estate agents, is we will do creative solutions. An example would be, let's say you have a family of 5 and you got one kid who maybe has a lot of health needs. Things are happening. They've got to go to specialists. They have the occasional trip to the hospital. They're going to need a different plan than, say, the rest of the family that only does preventatives. And we'll split it up because that'll make the most sense for the family. That is just kind of part of how I think of it as Rubik's cubing, the healthcare plan so that it meets the needs of each individual. So very proud of the job that we've been doing on helping agents with this plan. A lot of people want to know, okay, so I heard you say you offer some Clearwater plans and then also some other plans. What does the split look like? How many people choose what? So I'll share with you that about 85% of the agents we talk to do choose one of the Clearwater plans. And then about 10% choose one of the major medical plans. Typically, those are people who have ongoing medical needs. They've got some conditions that need to be managed. And if that's the case, the Clearwater plans aren't going to be a good fit because they're limited on some pre-existing conditions, but not all. It gets complicated. And then about 5% of people we talk to are in that you're already on the right plan, stay right there, call us if it changes category. So that's kind of the breakdown of what people end up choosing and enrolling in. I want to share with you at a high level what the biggest values are to the Clearwater plan, since that's about 85% of what people choose. The plan is a combination of a few different services put together. We have included in that is unlimited. Included in that is free unlimited telehealth, which is great, $0 out of pocket. A lot of plans in the US include telehealth, but you have to pay a copay. Zero copay, unlimited, use it all the time. It's amazing. Peak times, you have to wait longer. Yes, that's true anywhere. Most of the time, on average, you're going to hear back from a doctor within about 30 minutes or maybe sooner. You can do dermatology that way. You can even do mental health that way. There's options for virtual mental health, like therapy, counseling, even psychiatry through the network that works with TeleDoc. You're probably not going to find your doctor in that network. It's an option that's available. I believe the fees are $85 a session and $95. Those are the copays. So those are, it's something. I know that we have a family member who sees a psychiatrist and it's $135 for a half hour. So those are pretty good. Gives you something to work with. And mental health has come more to the forefront, and that's a good thing. So we're really proud to be able to offer something. The next thing I want to share with you is that the plans also include, it's actually like a light insurance plan. That's what I think of it as. It includes your preventatives. So the 73 things that are prescribed by the ACA, the Affordable Care Act, as preventatives are included in this plan for everyone who is enrolled in one of the Clearwater plans. And that is if it's $0 if it's done in network, and the network is actually a nationwide network. So it's not just limited to your town, your state, that kind of thing. And that is a nationwide network that is on, it's called PHCS. It's one that a lot of plans use. Is it perfect? No, it is not. But it does have most providers, and it has a lot of them in most areas. And there are pockets of the country, usually rural or more sparsely populated, that there is, there might be an absence of providers. And we actually have a beta plan that we're working on right now that allows people to go to any doctor who accepts self-pay. So we're constantly innovating and looking for ways to solve problems, meet the needs, and do what we can to improve healthcare options for agents in the US. The third part of the plan is medical cost sharing, and this is of the Clearwater plans. The third component of the Clearwater plans includes medical cost sharing to address and pay for the expensive things. So this would be emergencies. Let's go back to that example of the teacher here in Austin, Texas. So if he'd been enrolled in one of the Clearwater plans, he would not have had a $105,000 bill, because it doesn't matter what hospital you go to. He would have been on the hook for just his, it's called an initial insurable amount in the medical cost sharing world. It's a lower amount because it's tied to the need, which I love, because that's when you find that you have, that's when the expenses start to kick in. Most people don't want to wait till $13,000 or $16,000 before something kicks in. And by the way, for the teacher who had that heart attack I told you about, and he's fine now, which is a great story. That $105,000 that he was charged does not count towards your deductible or your max out of pocket, because it's not attached to anything involving the network. So it's just a horrendous system. And it feels really good to be able to make some positive contributions that improve things for people. So an example in this case, if that teacher was on one of the Clearwater plans, he would have gone to whatever hospital, and the first, he'd pay the first $2,500 if that's the plan he chose, and the plan would pay the rest. Not only that, but let's say that happened in November, and let's say that in February he had a complication, he went back to the hospital. Well, he doesn't pay the $2,500 again. It's tied to the need, and the need is tied to getting you well, healthy, and that would be symptom and treatment free for 12 months, and not tied to the calendar year, tied to when the event happens. So I think that's vastly improved and much more closely mirrors what our experiences are and our needs. So love that part of it. This means that no matter where you are in the world, if you're enrolled in one of the Clearwater plans and you have an emergency in Barbados or Switzerland or Puerto Rico, doesn't matter. You are covered. You have access to care. Yeah, it's pretty awesome. So we've got a couple of great stories. One of them is an eXp agent came up to us at eXpCon and said, "Oh my gosh, I love you guys," because I was in fill in the blank with the name of the island that I forgot, and I had a stroke, and they didn't have anything there on that island that would help me. So they life flighted me over to another island where I got the care I needed, and I'm only out my $2,500. I know, substantial. That's how we need care, because that's what happens. And this kind of a plan provides better access to what we actually need. And I think it fits a lot better. So that's an example of what it might look like if you have an emergency and you're on this one of these Clearwater plans and you are not in your hometown and you're not in your network. Now, the other example I want to give you is, what if you get a cancer diagnosis? Now, I know something about this because I recently had a battle with cancer. No one wants to have a battle with cancer. Yeah, I'm happy to report that I am disease-free. I had my battle with cancer during COVID. Don't recommend that. It's really terrible. I mean, yeah. So March 2nd, I got the diagnosis that was actually the second opinion. Second opinion is another service that comes with the Clearwater plans. Cannot tell you how valuable that is, because that literally saved my life. Wow. I'm here in Austin, Texas. We have a couple million people. It's a pretty good sized town. I went to a doctor who had a great reputation, been at this a while. He's not fresh out of school, highly regarded, but he and his pathologist completely missed something that MD Anderson saw. Had I continued with the treatment plan that that doctor recommended, I wouldn't be here today.
No.
The second form of cancer would not have responded to that and required that I do chemo, lots of it. And major surgery and maybe a trial if I qualified. So this is what your hair looks like when it's grown out 1.5 years, because I lost all my hair, and that is hard for a lady. It is.
Yes. Oh my goodness.
It's hard. I hear these young women saying they're going to shave their heads, and I'm like, honestly, I don't recommend that you do that. It is not fun. But that's the least of it. You know, it saved my life. I had chemo for 3 nights, 4 days, every other week for 8 weeks. By myself in the hospital, because we were in the middle of the quarantine. It was before vaccines. Then I had major surgery. The doctors described it as there's no more major surgery than you can have, abdominal surgery. So they removed organs, they rerouted plumbing. It is something.
Wow.
And it worked. And all of this is about $450,000, and I'm out of pocket $1,500.
You're kidding me. Wow. Wow.
That's what a plan looks like when it's working for you. Now, that said, I think this is kind of interesting. A year before I joined Clearwater, we left my husband's retired teacher plan. He was a teacher in Texas, and we had the good insurance. Yeah. But every year it got worse and worse and more expensive, didn't cover as much, shorter, smaller network. We switched. I didn't expect to get cancer. I'm a healthy girl. I eat healthy. I don't drink sodas. I don't smoke. I do all the things. I thought I had a deal with cancer. I'll do my part over here and you leave me alone. And sometimes that works and sometimes it doesn't. Point being that then all of a sudden I've got this awful cancer diagnosis and I don't have the problem of someone in a cubicle somewhere saying, no, you cannot have that treatment. You may not go to that hospital. You may not have a second opinion. I don't have anybody stopping me from getting the care I need. That's what we all deserve.
Absolutely. Absolutely. Wow. And I wanted to ask you questions in terms of enrollment. So as an eXp agent, you can opt in upon enrollment. So you can enroll upon coming into the company as a new agent. And is there a point in time that you can enroll? Let's say you opt out of it when you first come into the company. Is there a point in time that you can rejoin?
Well, there is. So there's two answers to that question. One is if you qualify, if the Clearwater plans are a good fit for you, that's actually available for enrollment every month of the year, all the time.
Okay.
So no matter when you join, if you change your mind, things change in your life, you can join any month. That's important because this is a big attraction tool for a lot of agents looking to grow their business.
Right.
And that means that it's not just timed with open enrollment as the federal government decides it is. The second thing is that if you are really needing a plan more like one of the major medical plans like Blue Cross or Aetna, that will be limited to two things. One, open enrollment, which right now has been extended to January 31st. And two, one of the qualifying life events that allows you to enroll in major medical outside of open enrollment. And those are things like you move, you add or subtract family members, you lost your plan through an employer or something like that. In those cases, for those 10% of the people we talk to, so for the 10 or so percent of eXp agents we talk to in the US who really do need a major medical plan, the open enrollment period for that's determined by the federal government. This year it's been extended to January 31st. There are three or four other qualifying events that allow you to enroll in one of the major medical plans outside of open enrollment. And they are things like you move, you've lost a healthcare plan, health insurance through an employer, or the COBRA's expired, those kinds of things, or you're adding or subtracting family members. So there's one or two others, but that will give you an idea of what the options are for outside of open enrollment. I don't know who thought open enrollment should be over the holidays at the end of the year, but that's what it is.
Yeah, no, that's good. Thanks for the information. And the reason I wanted to make sure we capture that is because I have agents who are in the process of potentially becoming full-time. They're in the process of leaving another job. So they're thinking about foregoing whatever, healthcare options they have in place at the moment, and knowing what, the opportunity we have here at eXp, they want to take advantage. So thank you for that information. Appreciate it.
It's my pleasure. One of the things that we have are a lot of interviews with different eXp agents sharing their stories of what was it like to talk with the consultants? What is it like to have the plan? How much money am I saving? What do I like about the doctors and the access to the hospitals? So we've got a bunch of those, and I can send you the link. There's a playlist on our YouTube channel, but it has a hidden link. So I'll send you the link.
Yeah, that would be amazing. Thank you.
Yeah. Recently, I recorded an interview with Chris Stone out of Maryland, and he said, and we have this on video, I just was so surprised. He said, well, we were looking at a lot of different, agents, and we liked what we saw with the eXp, but we were also liking what we saw with another brokerage. And then he said, and then I talked to eXp agent healthcare consultants and I was sold. So he actually went ahead and enrolled and then switched his license over. As long as you do it in the same day, it's fine. So that's the only qualification, is that you have to be in the US licensed with the eXp. That's it.
That's amazing. Thank you so much, Margo. It was honestly a pleasure having you. Thank you for spending all this time with me, sharing such an amazing information that a lot of people actually don't know. And that's why I wanted to bring on here. So thank you. And if anybody that's watching and you found this helpful, give it a thumbs up. And if you have any questions pertaining to just enrollment, having more access to information, that I know Margo shared a lot of information, but if there's anything that you want to get more of a deeper information on, get in touch with me. I'll be happy to put you in touch with Margo and her team so that we get you the right information. Thank you so much, everyone, for watching, and I'll see you next time.